We'll wait for, Bob asked me to give him like a 10-second start here. We're good? Okay. We can start here. Thank y'all for being here today. Good afternoon, everyone. I'm George Roberts with the Northeast Texas Public Health District, and I'm joined today by our Smith County Health Authority, Dr. Paul McGahey, as well as Dr. Mark Anderson, CMO for CHRISTUS Tyler, and Dr. Tom Cummins, CMO, Chief Medical Officer for UT Health East Texas. We're here today to discuss the sharp increase in COVID-19 cases in our area. We've now been over 8 months into this journey as we announced right here in this room the first 3 positive cases of COVID-19 in Smith County on March the 13th, 2020. So where are we now? Well, the virus is still with us, and we must continue to take these measures in the coming days. And they are, first of all, number 1, stay home when you're sick. Number 2, avoid large crowds and large gatherings. Excuse me. Number 3, social distancing. We've learned that term a lot in the last 8 months. Stay 6 feet away from each other. Number 4, decrease the number of places that you go out and about the community. Number 5, wear a mask when you're out in public, covering both your nose and your mouth. Number 6, wash your hands often for 20 seconds. Number 7, cover your cough and sneeze. Number 8, clean and disinfect those surfaces. Number 9, keep your hands off your face, your eyes, your nose, and your mouth. And number 10, right now, if you haven't received it already, we've seen a lot of people doing this, but if you haven't gotten it already, please get your flu shot today. This is one of the best measures you can take to protect yourself from the flu, and also potentially, we don't want you to potentially have the flu and COVID-19. So these measures are crucial to protect older adults and persons with underlying medical conditions who are at risk for a more difficult struggle with COVID-19 than our healthier population. So today, you've seen me share at various gatherings a number of different charts and things. I don't have as many charts because I really want you to hear from our physicians today, but I have several I want to share with you to kind of document the rise in cases. And our first one here, this is fresh off the press here today, is our 7-day, what they call our 7-day rolling rate of COVID-19. Again, this is the number of cases, when you see up there in Smith County, 59.05, that means over the last 7 days, there's been an average of 59.05 individuals per 100,000 in the population that have been tested positive for COVID-19. You also see other areas of the region are high. Wood County, Gray County, Rains County, Van Zant County, Henderson County, and Anderson County. And you'll all notice that they're all in the red. And red means substantial spread. And that's when when we developed this guidance a couple months ago, this is the time we really want to be super intentional about how we pay attention to this. But again, we're at the red level right now. Our second is our net health COVID-19 daily new cases. Again, the number there shows the case volumes per day, the day they test positive over our 7 counties that I just showed you on the 7-day rolling rate. So that's a 7-day, but you'll notice there the high rates are actually surpassing what we saw back in July when we had that huge spike. And to bring that a little bit closer to Smith County, since we're here in the Tyler City Council chambers, you see that same information right there. Again, it still shows the number of cases rising, and it's really at the levels as it was back in July. This right here, and you're hear the hospitals talk a little about their current experiences with COVID-19, but this shows the trend line on the hospitalizations. Again, this shows it's East Texas patients in Tyler, Texas hospitals. So it doesn't mean it's not just Smith County patients, it's patients from all over East Texas that are in our Smith County, Tyler, Texas hospitals right now. The peak on this chart was 214 on last Tuesday, the 17th of November. I will tell you, I received the report about where we are today. Today we're at 221. So we're at a peak level right now on Monday, November 23rd, 2020. So that was not reflected in the graph. So again, you'll see an uptick in the graph as of today. This is a chart here. What this chart basically is the percent of hospital capacity in combined hospital data for RAC-G. So RAC-G is our trauma area. It includes counties in our about 19 county area. It includes such counties as Smith County, Gray County, and several others. But basically, what we're looking at there is high hospitalizations as defined by the governor's order, GA 32. Any business establishment that otherwise would have 75% occupancy or operating limit may operate at only 50% when this rate gets to 15% or over for 7 consecutive days. Does that make sense? So we'll ask questions. If you have questions, we'll clarify that. But again, it's the number we're looking at there. We want that number to stay below 15%, because again, if it goes above 15% for over 7 days, then our restaurants will have to have reduced capacity there. Couple more. That's our dashboard from Friday. We'll be updating that dashboard today. And finally, when you have questions, I know you and the media have done that, but for our public at large, if you have questions, we're updating our dashboards every weekday. Please go to nethealthcovid19.org. Check out, we have lots of a variety of information that we put out there every day. So please go to the information and check that out. And now, let me introduce Dr. Mark Anderson, who's the Chief Medical Officer for CHRISTUS. Dr. Anderson.
Thank you, George. Happy to be here today to talk about COVID-19. As you've heard already at CHRISTUS Health, we've been really aggressively planning and preparing for this pandemic since before it started in Texas. We focus that around our associates, where we recruit and train, our PPE so we can protect our associates appropriately, our testing, and our inpatient facilities. That in combination with all the other plans we've made, we're really prepared for this surge that we're seeing this fall. While we had a lull over the summer, we've been able to recruit additional personnel. We've expanded our beds within the Bradley Thompson Tower, added 96 additional beds. We have more critical care capacity than we've ever had previously. We've expanded our testing so that we have antibody, antigen, and molecular PCR testing available, and we're ready. So at this point, we're doing well. We are seeing the highest number of cases we've ever seen in the hospital. We want that number to decrease, because that's what we can do safely in our communities, is to keep those that are vulnerable from having to be admitted to the hospital. We can provide great care, not just COVID care, but all care across the spectrum. It doesn't matter whether it's orthopedic, cardiovascular, neurologic. We need to be able to provide that care for our communities. People do not need to stop coming to see their doctor for illnesses. We need to have them continue to come to the hospitals. And our hospitals are safe, healing environments for those patients and families, whether or not they have COVID-19. We're ready, but we need you to help us. So things that you can do to help us, just as George just said. Please wear a mask when you're in public. Wash your hands frequently. Ensure if you're in a group, social distance with at least 6 feet between you. And finally, don't go outside and go to work in public places and school if you're ill. Stay home, because that way, whether or not you have COVID-19, you're less likely to transmit that disease to other people. With all of us working together, I think we can actually get through this surge. But again, the purpose is we need to flatten the curve. CHRISTUS Health is ready. We want you to help us. Thank you. George, turn it back over to you.
Thank you, Dr. Anderson. And now I'm inviting Dr. Tom Cummins, who's the Chief Medical Officer for UT Health East Texas, to come up here. Dr. Cummins.
Good afternoon. I'll echo Dr. Anderson's points about being ready. UT Health East Texas has been working diligently since late winter and early spring, preparing, getting our staff ready, our supplies ready, our rooms ready. We continue to surge and flex capacity as we need to. As we get busier with COVID patients, we find more ways to take care of them. As it calms down, we ease back. We continue, though, to provide a good, safe environment for care as well. People should feel good and safe about coming to any of our facilities and knowing that they're prepared. But like Dr. Anderson, I want to talk about a few things that really do need to change, and we need you to consider to help protect the county, to protect our staff so that we can continue to meet care. We know that every time there's been a major holiday since Memorial Day weekend, within a couple of weeks there's another surge of cases. Every facility sees it, every facility can project it. This is no different. Thanksgiving's coming up in a couple of days. We know there will be another surge of cases. Christmas will come, New Year's will come, and as people come together and gather, those become spreader events. So what I would really encourage people to do is to avoid those big family gatherings. As hard as that may be, as much as we love to see our family, I've got family I haven't seen in over a year, but I don't feel like I can safely go see them in other states because I could carry it to them. And so I would ask you to think long and hard, think twice about big family gatherings, big group gatherings, big Christmas parties, big New Year's parties, because we can all safely say that those will become spreader events. Those infect other people in the community, oftentimes infect our staffs. Every hospital staff that I'm aware of has had trouble with people being ill from COVID, not that they got it at work, but because they picked it up in their community and then came to work in with it. So the best way to protect ourselves and to protect our community for the next several weeks is let's hunker down, stay home, wear our masks when we go out, but avoid those big events where we're likely to get super spreader activity. So in the meantime, UT Health East Texas will be there ready to take care of you. We'll meet the needs that you have, both COVID and non-COVID, but we want everyone to be safe so we can meet all those needs. Thank you.
Thank you, Dr. Cummins. Let me just recognize Tracy Walker, I left, who's doing our sign language interpretation for today. Tracy, thank you so much for being here today and offering such a valuable service to our community. Next, I want to invite Dr. Paul McGahey, who's our Smith County Health Authority, to come up here and talk about the vaccine. Dr. McGahey?
Thank you, George. Good afternoon, everyone. And I really shout outs to Dr. Anderson, Dr. Cummins, the tireless efforts of our healthcare workers and facilities all across East Texas are amazing. We owe them a great debt of gratitude. So thank you for all you're doing. George, to the health department, all the workers there, and for public health officials all across East Texas, thank you for what you're doing. I get to share some really optimistic news about vaccine. I know you've been reading a lot about the vaccines. Started with Operation Warp Speed several months ago, and just an unprecedented research and development and production of vaccine like we've never had before. And we're on the cusp of receiving those vaccines in the East Texas area, probably sometime in December. Two come to mind, specifically the Pfizer vaccine, which you've been reading about, and the Moderna vaccine. Well, both of those in early efficacy studies or effectiveness studies have shown to be about 90 plus, 94% effective, which is really amazing. They were hoping for at least 50% effectiveness, and now they eclipsed that. So we're very hopeful. Early safety data is coming out too, that the vaccines appear to be safe. Now we'll need much more data on effectiveness and vaccine safety. We'll be getting that in the near future. So where these two vaccines are at right now, they're going before the FDA and their advisory panels in a part one of a two-step process. They are presenting their data, about 100,000 page document plus, to the FDA, and a lot of scientists, a lot of public health officials who I have a lot of confidence in. I think we in the public health community have a lot of confidence in, are evaluating that to deem that safe or not safe. And they'll be ruling on the Pfizer vaccine probably in the fairly near future. Moderna's closely on their heels. If approved, that will go before a group at CDC called the Advisory Committee on Immunization Practices, and they would have to give their blessing. So that's a step two of a two-step process. Once that happens, then vaccine can start being administered. Now, throughout East Texas, throughout Texas, and the nation for that matter, people are registering in Texas with the Department of State Health Services to be receiving signs. All the hospitals here have done that. Others across the state are doing that. And we are poised now to start receiving supplies, start receiving vaccine. And once we get the green light through this, what we call emergency use authorization, we can start administering vaccine. And some of you may have heard or seen of the governor's press release he released this morning about who those initial prioritized people will be to receive the vaccine. There are millions of doses which are in production now. Of course, many of these vaccines require 2 doses. So we'll need millions and millions of doses of vaccine. But with limited doses coming in, the state is prioritizing populations for receipt of the vaccine. And the first group, they call it Tier 1A, will be healthcare workers. Those on the front lines, putting their life on the line in many cases, will be the first earmark for that. And gradually over coming weeks or months, Others will be in line to get the vaccine. And so probably will be around April-ish or thereabouts before it comes in sufficient quantities where everybody, whoever wants the vaccine, can receive it. So based on safety evaluations, effectiveness, we have a lot of cause for hope. There is a light at the end of the tunnel, and we're excited about the prospective receipt of vaccine in the very near future. Thank you, George.
Thank you. Okay, so we're now ready to take questions from the audience here. So not sure how we want to, maybe we'll start with, John, we'll start with I'll just kind of look this way and kind of go around the room while we do it like that.
Yeah, that's fine. It was just touched on about the holidays. So it looked like July 4th and Halloween were the big ones. What is your concern with Thanksgiving and Christmas, and how close are we to having a shutdown again? Like you showed that number, 13.5%.
Right.
So those are my two questions.
Sure. Well, the shutdown would come. That would be more the governor, state of Texas. That would be more coming from his area. But again, I think Dr. Cummins probably said it well with and Dr. Anderson. It seemed like holidays when there's get-togethers with families, maybe they don't see each other a whole lot. That's when these situations tend to spike up. So I think we see, Thanksgiving's coming this week. We see Christmas on the horizon, New Year's. And so we anticipate spikes that are coming out of that. And I don't know if would y'all like to respond any further, Dr. Cummins?
Well, I would say it was like I said earlier, you can predict it. Holiday happens, slow and then a quick rise in cases, regular as clockwork. So, we had as you said, 4th of July, Labor Day, lake parties, end of summer parties, Halloween, big surge. With the way Thanksgiving, Christmas, and New Year stack up, there's a potential for a really large surge coming in through mid-December into probably early February even. So if people really don't do those things that we're recommending, I think all of us would predict that that's a likely outcome.
Early on, maybe the two hospitals can speak on this, there wasn't a concern about children. It was almost an afterthought in February and March. But we've seen that through Halloween. Are you seeing that, more elementary to middle school and high school students with the virus?
We are seeing a fair number of children testing for it. Again, the level of illness hasn't been as high as it often is in adults, generally. Now, that's not to say that there haven't been some. I know we have a teenager in one of our facilities currently, so they can get quite ill from it. But yes, we're seeing a significant number of children that are testing positive, and family members of those children, et cetera.
Could I would you mind speaking on, not on behalf of, all of the East Texas CHRISTUS facilities on that?
We still see the dominance in an older age population, but it's really across a broad spectrum of ages as long as there's comorbidities present. So obesity, diabetes, hypertension, cardiovascular disease are all risk factors. Because we see less of that in children, we see less severe disease in children. Do you see instances, however, requiring patients to be transferred to a children's facility where they have an inflammatory response or other associated illnesses from COVID-19? Again, children and younger people are less affected, but we still see some individuals that become acutely ill with it.
And when we're talking about April maybe for the mass, but what about your employees, your frontline workers in East Texas? When do you think they could get the vaccine?
That's going to be up to the state on the distribution plan, so I don't have a full information on that yet. We certainly believe frontline healthcare workers among those that need the vaccine early because they care for all of us, so it's important. But we also want to make sure the patients that are at high risk also receive it. So I think there'll be plans coming forward, and Dr. McGee can talk more about that as we find out. So.
I thought it'd save you 1,000 emails, that's all.
Thank you.
Did you want to hear from Dr. McGahey on
Yeah,
that,
if you know it's more of a timeline, because I only heard the April timeline for, I'm just wondering.
Well, I don't have an exact timeline. There is an expert vaccine advisory panel giving advice to the commissioner, who then in turn passes that information on to the governor. It's a lot of steps in that. You keep hearing different things daily. I would an educated guess on when it could arrive for the first tier group, the healthcare providers. I'm thinking quite possibly in December. Not 100% sure on that. And as vaccine continues to roll out, that vaccine advisory panel will be giving suggestions or advice on where it should go, to whom should receive it, and it will be logically distributed to those who we would think it would be. Healthcare providers, those at high risk with high-risk conditions, long-term care, staff and patients, and other individuals, first responders. So it's a very logical, thought-out plan. As far as the timing goes, I'm sure that we'll be the first to share that information whenever we have definitive information on that.
Thank you. Sorry.
Great.
Let me ask you, as far as net health in the coverage area that you guys handle, how does that look in light of Texas and in the nation overall? What are we seeing locally compared to some of the things?
Yeah, we can go back to the.
Yeah, right there.
He's asking the question. I've been asked to repeat the questions here. So you're asking the question: how is our experience here in East Texas versus the rest of the state? So let me go back here to our rolling rate. So, one of the measures here is our rolling rate average. Really, throughout the state of Texas has seen a spike. We're seeing some real spikes, and I talked about, so there's our rolling rate there. The thing that I mentioned right there at 13.7% capacity, there are several areas of the state that are basically have reached that, have surpassed that. El Paso, I think there's an area down the valley, and be specific to that. I'm sorry. Amarillo, so it's Amarillo, El Paso, and some area in the valley, I think. So those three areas have basically hit that over 15% number to cause that. El Paso's the big spike on that. Tim,
Appreciate it.
did I answer your question?
Yes, sir.
Okay, any other questions?
Also, with you mentioned the flu vaccine, or the flu coming on, how much concern is there that we'll have a double dip of,
Oh, we're major concerned of that. I mean, that's one of the,
that means that
yeah, basically, so they could be, right now, the flu right now, people are, I'm pleased that people are getting the flu vaccines. Our numbers look pretty good. I think that, the hospitals are seeing some good response to that. The pharmacies are doing good. So I think people have heeded the message on that, but it's still, if you think maybe it's too late to get a flu shot, it is not too late to get a flu shot. So please get your flu shot right now. But yeah, the convergence of flu and COVID-19, flu typically, it basically, causes the hospitals to reach capacity in their systems. Typically, I had a seasoned physician tell me one time that February 4th seems to be the peak of flu season, and so we're a couple months away from February 4th right now. So please, everyone, get your flu vaccine. That's one of the things that we can do to prevent the flu spread this year, along with COVID-19. Let's see. I guess Zach, did John say you're good, or do you have a?
You got it covered.
You're covered, okay.
Yeah.
Frank?
Yes, sir. So one of the things, I know we hit on this earlier. What's one thing that people are doing that's really just making this like the biggest thing you think?
I think, and I'd like everybody to respond to that as well. My sense is, the question is, what's one thing that's causing the surge to happen? I would submit to you that it's COVID fatigue. If you go around the community, you're seeing a lot more people out and about. You're seeing activities. People basically we're, as I said earlier, we're 8 months into this, and we were early on. We had a shutdown. People stayed home, but people are ready to get back to their normal day-to-day lives right now. And the reality of the situation is that while we maybe have fatigue, the virus is not fatigued with us quite yet. So I'll let Dr. Anderson, Dr. Cummins, and Dr. McGahey, if you would like to respond to that as well.
Yeah, I think I would agree with that the overall COVID fatigue, but just the tendency to be gathering in large groups, not masked, whether it be church services, football games, high school events. I was relating a story a little while ago. I was driving down the street of my neighborhood, and large number of people dressed up really nicely for some event in somebody's house, no masks. And so I think that general lack of mask wearing in public, fatigue, whatever the cause, is probably driving a lot of this.
So I'd agree with both George and Dr. Cummins. At this point, we saw the greatest flattening of the curve when we had the most social distancing. It's really our only effective means until we have vaccine or some other treatment available. So as we opened up society, we got together more activities, schools, sports, other activities, back into our restaurants. It's inevitable. This is an expected surge. It's inevitable that we're going to see more spread in our communities. The same thing can occur with influenza as happens with COVID-19. We believe that's why it's important to take these certain measures, wearing a mask, washing your hands, social distancing, mainly don't go out into public ill, and we'll be able to flatten the curve again.
I would agree with my colleagues here, all good points. I think if you look at the statistics and analyze what's happened over the last 2 months, it's been kind of generated from young adults, those 18 to 30 years of age. If you look at the curves that George has and others, people sharing air, basically, getting within 6 feet from one another, more than 15 minutes. And as you know or recall, for every person who has a case, they can spread it to 2 other people. So that's 2 spreading to 2, spreading to 2, if there aren't social distancing guidelines in place. So a lot of it is social mingling among young adults. Some may not think it can affect them, and usually it doesn't, but more and more young people are getting more sick with it. But as we know too, if you pass it on to a young adult who passes it on to another young adult who passes it on to the father who passes it on to their grandmother in the nursing home, that can end up in a fatality. And there was an article that came out about a wedding last week where everybody gathered, no mask or anything. I think 70 cases emanated from that. Another seating of a population in a prison, I think 200 cases were from that, and then 1 person died. So you just never know. And so we need to be mindful of those who may not be around us, but that 2nd or 3rd generation spread could wreak havoc on a lot of populations.
Thank you. Any other questions? Yes, sir.
First and foremost, thanks again for everyone being here today. I have a few questions in regards to this upcoming season. So, of course, we've got Black Friday coming up, Christmas shopping this season, and Tyler, Smith County area is known as the retail hub for East Texas. And so, is that going to be a major concern, and what do you ask people to do?
Well, I think that you're seeing there's lots of I've seen some of the stores are doing the Black Friday. It's not just Friday now. It's basically pretty much from now until Christmas is going to be. There's not one big day. So I think that I would encourage everybody to limit your shopping experiences. Try to get your things done, but try to do it maybe at some off hours. Try to the online shopping experience. Lots of places do online, but I think basically just be cognizant out there. It doesn't have to be one day of shopping. It can be several days spread out. We want you to still, go to the retail outlets and things like that. Do what you need to do. But again, we talked about this early on. Probably right now is not the time to, when you go into a store, to just go for a shopping a multi-hour experience. Kind of go with an idea in mind what you need, and take care of that need, and don't just stay there for forever and ever. But you're right. This is a shopping mecca we're the kind of shopping mecca for East Texas. So just ask people to be smart about it when you're out there. Social distance, like we talked about. Don't shop if you're feeling bad. If you're sick, don't try to do that. Wash your hands before you go in. Have your mask on. Cover your nose and your mouth. Those things like that. So just exercise some wisdom right now. We're trying to keep life going in the middle of a pandemic. And again, as I said, I'm personally tired of the pandemic. Everybody else in this room is tired of the pandemic, but unfortunately the virus is not tired of us yet. So we have to continue to be vigilant and diligent in how we approach all this.
Thank you. And with that being said, of course, how do we prevent East Texas from becoming the next Lubbock or El Paso? What are some of the things that you'd like to address for that?
Well, I think what we really have talked about here today is basically be mindful, be vigilant. Again, the virus is not tired of us yet, although we may be tired of it. So we have to keep on the diligent work that we've done for really 8 months. Stay home when you're sick is really my number one. When people ask me, what's the number one thing that you can do? If you go out when you're sick, regardless if you have COVID-19, the flu, or any other type of disease, you need to be staying home. So stay home when you're sick. keep that social distance, wear that mask when you're out in public, wash your hands often. Those are the things that we can continue to do. Just be diligent about it. And then if you get the virus, stay home and try to separate yourself as best you can from your family members, because that's, you know, there's even situations if there's a way that family member can be placed in an area of the house and maybe meals brought to them, maybe they can have their own separate bathroom as possible. Those types of things keep from maybe spreading it throughout the house. Y'all, anybody want to comment? Anybody else want to comment on that?
No, I would agree, do all the things we've been talking about, otherwise it runs the risk of becoming another level of hassle.
Yeah. Anything? Okay. Anything else?
Yes, of course, with that being said, just out of curiosity, how many East Texas providers have registered to offer the vaccine if that becomes available?
Oh gosh, do you know the answer to that? I've seen some facts, and I think I saw one the other day.
I don't have the precise number. I
I
know.
think it's like 26 in Smith County, maybe.
Really? Okay, maybe 26 in Smith County. You know, thousands across the state. It's an abundance of medical healthcare providers, pharmacies, long-term care facilities. It's available to a lot of different outlets. So the uptake has been great. I think people are preparing themselves very well for that.
And then, of course, I'd like to ask a few questions to both CHRISTUS and UT Health. What treatments are you guys currently using at your facilities?
So we're going to ask Christus, and he's asked Christus and UT to, what treatments are you utilizing in your facilities for your patients with COVID-19? So, is Dr. Anderson?
It's a great question, and thanks for asking it, because it also gives me an opportunity to plug something I'll mention in a moment. So we do have a full range of treatments at this point. We do participate in remdesivir, which has received FDA approval. We're also looking at the monoclonal antibody therapies, which is an infusion in the outpatient environment for patients that are at risk. We'll be participating in those emergency use authorization distribution as it occurs from the state. We, of course, use a variety of techniques when patients are before they're ventilated, including proning and supportive care, just like we would for any other severe respiratory disease. But the one thing I would like to mention is that I received notice last week from Carter Blood Bank that one of our therapies is becoming in more short supply. We use convalescent plasma, which is plasma blood obtained from a patient who has had COVID-19 previously. And by donating that plasma, we're able to then treat patients in the hospital. They are apparently running short in certain areas, particularly for blood types B and AB, I believe was the notice I received. So I would encourage anyone who's had COVID-19, please contact the blood bank where you could potentially donate plasma, which helps many patients.
So again, I would echo what Dr. Anderson said. We are using remdesivir, the IV steroids, IV Decadron, non-invasive techniques, the proning, et cetera. We too are evaluating the monoclonal antibodies. We know the supply we're getting, and we're trying to figure out exactly how we're going to use that and allocate it. Convalescent plasma has been used extensively in our facility, and I would echo Dr. Anderson, if you've recovered from COVID and you know you had it, please give. There are a number of people in East Texas who could use it and across the state that could use it, and there just isn't enough of it. So if you know you had it, please go to Carter and see about making a donation so that you can help treat your fellow neighbors. And the nice thing about plasma is you can give it repeatedly, so it's not a one-time deal. You can go over and over again as long as you test positive for the antibodies. You can continue to donate and help a number of people get over this terrible illness.
Thank you, doctors. And just I want to clarify a couple things. Proning, when he says proning, because I asked him this question the other day to make sure I understand it. Proning means that instead of the patient typically in the hospital typically lays on their back. So with COVID-19, they found early on there was a process you could lay the patient on their stomach. They call it proning, and that would basically that keep rotating the patient back and forth. That seemed to really be very, very helpful. So thank you all for that took a lot some research to figure that out too. And I'm going to jump on the Carter Blood Care bandwagon here. Please, if you've had COVID-19 and produced antibodies, please consider donating your convalescent plasma to Carter Blood Care. They're open 6 days a week. You can go to their facility in Tyler. I think they have several facilities around the East Texas area as well as in the Dallas-Fort Worth area. But the one in Tyler, and actually for those of you who maybe, if you've donated blood before, I actually saw it. It's actually a smaller needle for the plasma than it is for the blood. So it's less painful to donate your convalescent plasma than it is for blood donation. So it just takes a little bit longer because the plasma, they put it back to you as well, and they have the nice snack for you after you donate. So please consider that, and please give that prayerful consideration to do that, because you can really help your fellow man. I think they can actually get 4 units of plasma per individual donating.
And then last question, I appreciate all of your patience with me today. What is our status on our ICU bed capacity? By our estimate, about 9 out of 10 of those ICU beds are full in our trauma service area, about a third of those with a COVID-19 patient. And that is correct. Are you comfortable with our ICU bed availability?
I will pitch that back to the hospitals there for the answer there. So I'll let Dr. Cummins go first, and then Dr. Anderson.
Currently, we are comfortable with our ICU capacity. I mean, different days, different hours, our capacity varies, but we've been able to generate more ICU capacity when we've needed to, and continue to look for ways to do that as we have surges. Again, it goes to my concerns about the people getting COVID. Taking care of COVID patients often takes us away from the ability to take care of others, and that has created some ICU challenges from time to time. But right now, we feel good about both our ventilator capacity and our ICU capacity across our division.
Yes, at Christus, we were very fortunate. We opened up the Bradley Thompson Tower early this year. It gave us the ability to create a lot more ICU capacity. We're able to flex up that capacity. It takes more than just space. It takes trained nurses, ventilators, pumps, monitoring equipment, and we do have that. So we continue to be able to flex those ICU beds up and down as need arises. It's a day-to-day management issue, but at this point, we're fine. We're actually have adequate capacity in our hospitals and facilities, and we're able to take more patients. Again, it's a safe, healing environment, and we'll continue to meet the needs of the community.
Anything else?
That's everything. Thank you.
Okay, thank you. Alan?
Sure, just one question for Drs. Anderson and Cummins. It's one thing to add capacity and add bed space, it's another to add staff. Are you worried at all that with this expected increase in patients coming in over the next weeks and months, that you'll run into overworked, overtaxed staff, doctors and nurses, and potentially have a staffing shortage to treat patients?
Sure. So the question is, before Dr. Anderson and Dr. Cummins come up here, the question is about hospital staffing. He as mentioned, you have the physical space in the hospital, but the real issue is staffing. So how are the hospitals, Dr. Anderson, Dr. Cummins, how are y'all addressing the staffing issues, not only of your clinical staff, but also your medical staff?
So it's a great point. I think our associates, our nurses, and other members of our teams are our most important asset, our most important resource we have. And to that end, we're very much sensitive to their working conditions to ensure they have safe, appropriate attire and environment to work in. We have recruited very aggressively. We continue to do so. We also train nurses from being a med-surg nurse potentially to a critical care nurse. That's an ongoing process so that we always have the ability to staff those beds. I would like to thank our RAC because they are providing us with staff now. That allows us to basically give respite to some of our nurses that are on those front lines and also respiratory therapists. It's been a great addition. We thank the RAC and the state for providing those resources to us. The thing to be aware of course, is we have community spread, then potentially our associates will catch it from the community. They're going to take all the precautions we're talking about today, but that's how we ensure that the associates are still healthy to be able to come to work, is to take all the measures we discussed today. If we can flatten the curve in the community, there's less risk that our associates catch it as well. But again, we're actively recruiting, training, and ensuring that we can staff those beds.
So I would say yes. I think staffing is a concern for every health system in the country currently, between fatigue, burnout, stress, their own illness, and the continuing volume of patients that are coming in. Like CHRISTUS, we're doing everything in our power to hire, recruit, train, identify nurses who can move up a skill set. The RAC has been very helpful as well across our division. A number of our hospitals have been able to get some help. However, the holidays are coming, and some of those folks are going to want to break as well and be at home with their families for a little while. So I think all of us worry about it. We do all the things we can to protect our folks and to lift them up, celebrate them when we can. But yes, it is a concern. And again, as the numbers continue to surge, as our staff watch people do the things that we're asking people not to do, and then they're getting sick and coming in, that's another level of frustration that I think my medical staff, our nursing staff, our respiratory therapists, and all the others really struggle with. And so again, we're asking people to do the right thing by their community, which will help the staffing issues in the hospital as well.
Before we close here, are there any other questions from anybody else?
I have one more thing to say, George.
Okay, go ahead, Dr. McGahey.
Regarding the vaccine, we must definitely continue social distancing, not sharing air with other individuals, but the vaccine does represent a great hope for us to really stop the epidemic if enough people will take it. And I guess surveys have shown that about 58% of the American public are willing to take it. And we'll be hearing a lot of information in coming weeks and months about the vaccine, about safety and effectiveness, about the different vaccines. It will be very confusing, but hopefully we can clear up the confusion and to get to the point where if 70% of our population is either vaccinated or has had the illness, we will get into a situation we call herd immunity, where if you can vaccinate 70%, it will effectively block the spread to other community members. It will still continue to spread, but not to the degree that it's spreading now. So that's the hope. We hope people will consider the vaccination and get all their questions answered. There'll be a lot of great information. There'll be a lot of misinformation coming out. Get your information from authoritative sources. And it does represent a great hope for us moving into next year to really quell this epidemic and pandemic. Thank you, George.
Thank you, Dr. McGahey. Any other questions? So just to wrap up here, number one, thank you all for coming today. Thank you for sharing this information on a daily basis. We've been in this journey now for 8 months. I think, as we stated earlier, people are becoming a little COVID fatigue, but the reality is the virus is not tired of us yet. So please exercise those, be diligent during the coming days, because as Dr. McGahey mentioned, there is some light at the end of the tunnel here, ladies and gentlemen. There is light at the end of the tunnel, but we're still in the tunnel right now. So please exercise diligence. I appreciate the work that our healthcare systems are doing. CHRISTUS, UT Health, the great work that they're doing. They're managing this situation with their staff. They're working many hours. Everybody's doing a great job, and it's also Public Health Thank You Day. So the people that work for the Northeast Texas Public Health District, I say to them, thank you for public health, and really for the hospitals. You guys have kind of gotten into the public health business yourself too. So happy Public Health Day to you guys as well. So again, thank y'all so much for your time and attention today, and have a blessed and happy Thanksgiving. Thank you. Thank you, Tracy.